Hi, everyone. Welcome back to Dede Talks, the Art of Specialty Lenses. Today, I have a very special guest with me, Dr. Maria Walker. Maria, introduce yourself and tell us a little bit about what you do and how great you do it.
Sure. Well, welcome for me, and thank you for having me. It's nice to see you, Dede. So I am a kind of I guess the best definition is clinician scientist. I teach at the University of Houston College of Optometry, which is where I recently got my PhD, looking at basically the physiology of scleral lens wear and fitting scleral lenses. And so I teach in the clinic, and actually for the summer, I'm only teaching 1 day a week in the clinic. So I work with 4th year students fitting specialty lenses, and then the rest of my days I do research. So all sorts of different projects we have in the oven right now. But I've got what you would call, I guess, a translational lab, because we do like basic science stuff that's like bench testing tiers, looking at proteins, RNA, that sort of thing. And then the clinical aspects, right? So we collect these samples from patients, and then we do some like just straight clinical outcome studies. So that's probably the most general way of saying what it is that I do.
Fantastic. And congratulations on your PhD. We're all rooting for you.
Yeah.
So I just have a couple of questions for you. I know you've been in the business a while, and I've kind of followed your career a little bit as well. And we've met on several occasions. So I would just like to know, when you're doing specialty lenses, how much time do you spend educating your patients on their modality that you've chosen for them, or how you work with them to choose that modality, and how much you educate on the particular disease or issue that they have when it comes to wearing scleral lenses?
Yeah, so it really depends on the patient a lot of the time. So I definitely tend to explain a lot. So I have one of the luxuries of being in the academic setting is that we have a little bit more time to spend with the patients. And I have, students who I'm supposed to be teaching. So I oftentimes will teach the student and the patient together a lot of the times, especially the earlier in their career students. But I'd say I spend probably on average more time than most. So like there's some patients I have, I can think of a patient I saw the other day who's, gosh, I don't know what his job actually is, but he's some sort of engineer, but kind of a higher level, really smart guy. He wants to know all the nitty gritties about everything. And he wants to know, like literally we were talking about how, some people can recommend anti-inflammatory medications because of the inflammatory mediators, right? But for the most of patients, it's like pretty superficial. And then if they ask me more questions, I'll respond to them. And this is in terms of talking about the disease. Now, in terms of how I'm talking about scleral lenses, again, the talk I try to keep minimal because I want them to experience it before, right? I can talk in circles. When I grab a lens out of a set and I'm like, this, see this rigid piece of plastic that I'm showing you kind of goes on your eye like a bowl. And then, that makes a lot more sense to them. And then if they keep asking questions, like they're going to ask, what does it feel like? How's the vision? Then I say, well, let's put it on and see. But if they ask a bunch of questions, I'll answer them. But usually with those two things, I probably talk more about the disease. With scleral lenses, I try to get right into them actually experiencing it for themselves.
And are you utilizing, you said you're utilizing your students, are you also utilizing staff to help with some of that training when it comes to kind of on the front end and back end? What role does your staff play in that education?
Well, so one thing to sort of clarify is in the academic, at an optometry school, our students do most of the staff type of work. So, and we do use our staff for some things, but honestly, usually it's only if it's like a translation and we don't have a student who speaks the language and we have staff member. So I'll just kind of refer to the staff like duties that I have my students do, because
Right,
it's really
right,
them doing it, but it's a staff task.
right,
And so certainly with describing the scleral lenses, I have them do all of that, if most of that, if not all of it. Right. And because a staff member can easily describe a lens, it's not something that the patient is not going to believe,
right,
they're going to be pretty responsive to that. It's a piece of plastic of a contact lens. Anybody who as long as you're knowledgeable, they can
right,
describe it. The disease, again, my staff students are a little unique in that they know about disease, but I wouldn't, unless it was a staff member that had been there a long time, really knew some stuff about disease. Like, so, okay, so I can give you my, like, what I call my Darlene example, because Darlene is our like long-term, she's been doing clinical coordinating for 25 years. She knows what keratoconus is. She
right,
knows how
right,
to explain it to a patient. I let her go for it. So I think it's, a lot of it is determining who wants to talk about these things
right,
with patients and who's good at doing it. But I think certainly with the actual lenses, I don't need to be the words don't need to be coming out of my mouth. I can reiterate, I can kind of push the process along. But with the disease, they usually want to hear that more from me, once we've made a diagnosis.
right. So besides scleral lenses, what other modalities are you using? Are you using soft custom lenses? Are you using any sort of RGP designs? What are your favorite go-tos for a particular disease?
Yeah, so sclerals are most of my patients. And if they can wear them, especially any irregular corneas, I don't
Right.
see as many. So, I think for irregular corneas, I try to get them all into sclerals. I do use custom soft. I probably use corneal GPs a little bit. It probably goes sclerals, I use the most, then corneal GPs, then soft, mostly because the soft, I struggle to get the vision that I want. However, that being said, I know, and I've done some work with some of these companies that are doing highly, not just a thicker lens soft,
Right.
but like high HOA correction soft. So, I think I actually was just having a conversation with Jason Marsak the other day, who does aberration research here at the college. And I was like, man, if we could get soft lenses seeing as well as sclerals, that would be the way to go. I mean, of course,
Exactly.
that would be the way to go. And I sort of said it, and I was like, "Oh, but my scleral lenses that I love." I'm like, "It's fine. There's going to be a reason to use those." But just talking about, soft. But I think the optics still are not good enough with
Right.
the soft.
Right. Absolutely. And I agree with you in some aspects. I absolutely agree that there are places for every design out there. I mean, there really is, you customize it to the patient's needs. And I think that's the most important part. So what would you, as a practitioner, what would be your best tips for integrating specialty lenses or scleral lenses into a practice? What are your tips to get for that integration?
So yeah, I mean, like anything, and this is like a tip from my research world that totally can be jump over to the clinical world, is plan for it, right? So like for us, it's like plan your experiment, know what you expect, and plan for it, right? So a good example is, you don't want to have a keratoconus patient come in, first keratoconus patient, scleral lens, and then you have no materials to give them on handling, no references to send them home and watch videos on application removal. Your staff has no idea how this will be different. So it's all just about logistics. I was listening to something recently that's like 90% of success is logistics.
Right.
And I mean, with these, it's just get organized, know what lab you want to work with, right? That's the first step. is, well, first step is kind of like, see, okay, do I have patients that I could actually use these on, right? Because
Right.
what you don't want to do is start looking for patients who are happy in something else and try to steer them towards it, right? There's plenty of patients that are going to funnel right into this category. You just have to identify them either in your practice or in your community,
Right.
right? And then say, okay, I know where I can get at least a couple patients to get me started. Maybe you contact a local corneal surgeon, maybe look into your current patients. Mostly, right, keratoconus is around, so
Oh,
you're
yeah.
going to probably have these in your normal patients, and you just maybe haven't been using all the tools that you could have. Right, and then it's figure out who you want to work with. Maybe you want to work with a couple, fine. And what I've seen practices do that's been amazingly helpful, and I'm actually doing one of these I think in a couple of weeks, is have a couple patients and then contact the company and say, hey, can we do a little workshop here? I'm going to bring in these 3 patients. Maybe we give them a discount on the lenses to kind of get them in here, get us jump started, or even just don't discount the lenses. Maybe you don't want to do that in your practice. You don't want to devalue it. So maybe, you just say, maybe I'll get a fit set for a little discount, not even, but then they bring someone like me or someone like, anyone who does sclerals. We come in, we fit those first couple of patients with you.
Right.
And then you kind of, while you're there, you can ask all those questions. You can have staff members who can come and kind of try some lenses on each other. But yeah, I think bottom line, reach out to the labs and see which one is going to work with you and get you excited about it, because that's the jump off, right? Because that's where you're ultimately getting the lenses. And then, yeah, you just kind of go from there. And I also would say things not to do is like go out and buy all this fancy equipment, go out, right? Don't over plan, just start gradual. Maybe you get one person in the practice who kind of manages this type of patient. You fit them slowly. You maybe fit some cases where you think they might do okay, like maybe they've already worn scleral lenses, or they've, you don't want to start fitting the one who comes in and says, hey, I've been to 4 different doctors. None of them have been able to fit me. So you're the one who's going to be able to do it, right? Like I get those. And it's like, you're like, okay.
Or pick the worst patient in your practice, and that's the one you're going to fit.
The one who complains all the time, has every little issue with every lens. So not the ideal ones.
Yeah, patient selection is huge. I can tell you that for sure. And a lot of the labs will do these wet labs that you're talking about as well. I know ABB does it, and some of the other labs as well. So we can go in and help the practitioners work with particular products and things like that on that one-to-one basis. So the thing that I ask every one of my guests is, what is the biggest tip that you can give to a brand new optometrist that's just getting out into the business about the real world of specialty lenses and that type of thing?
Ooh, yeah, I mean, so I think a lot of it is the same things I would say to like I just said, to somebody who's fitting like a new patient. What I would say to them is, one, make sure you have realistic expectations.
Right.
Because what you're not going to get in most cases is a practice that's going to go out, like I said, and say you're joining a practice and buy you all this fancy equipment, or they're not going to go out of their way for you. Okay. It's your job to go out of your way and prove yourself, really, especially if you're a brand new grad. So what I would say, if I was in practice, and I'm seeing all these guys graduate too, they just did. And we've got a good 4th year class, but I don't know how many of them would take initiative on this even. So a good example is, say you started a new practice, go to the guy who owns a practice and say, hey, I'm interested in doing some specialty lenses. Would it be okay if I drafted a letter about our services, and, we can put it on letterhead, and I could send that out to some corneal surgeons, and I could, maybe start to grow this practice.
Right.
And then see what they say. Right. Or, open-ended, but like, I'm going to do the work. I'm the new guy here. I want this. And here's how I think we can do it. But think about it, take a look around the practice, make sure it's appropriate, right? So like, take a look around and say like, oh, I see how we might be able to fit some specialty lenses into, the flow. And maybe if we, I've noticed Friday mornings are a little slow on this side. So, maybe we could do something where we start to just gradually work them into a Friday morning clinic, right?
Right.
I don't know a doctor who wouldn't be like, even if they're like, no, we're not doing that, but I love your enthusiasm. Let's do this. Or,
Right.
Here's how we can work with it. But I think saying to them, hey, can I try and recruit some patients from the, that you don't already have here. So
Right.
I'm bringing more patients into your practice. It might be one a month, but that's how it starts. And see if they'll give you a little bit of, initiative. But don't say, hey, I need one of the techs for 6 hours tomorrow so that they can help me put together all this stuff for this, right? So I think, I think that's the best approach as these.
Well, and I absolutely agree with you. I think that is, in your promoting yourself throughout that whole process. So I absolutely agree. I think that's a great tip.
Yeah.
So I know you have a passion for contact lenses. There's also another passion that you have, and a passion that we share, and that's your puppy. So tell us a little bit about your puppy and your passion with that dog.
So actually, I didn't tell you this before. You're finding this out. I actually have 2 dogs now.
Oh, yay!
I know. Just couldn't keep up. Just couldn't do it. So yeah, I think anybody who met me the first year that I got Ace, who's my black lab, who I've had for, gosh, I think it's 4 years now, a little over 4 years. But I swear, anybody who even like knew who I was in that first year knew who Ace was. And there was a couple,
absolutely.
There was a couple times that I actually got up to like give a presentation, and his pictures on my backdrop, and like murmur, people would like heckle out things like, "Oh, Maria's dog, talked about her dog." So yeah,
I think that's about the time we met, Maria.
probably it's happened a few times, but I love it.
Yeah.
So Ace, so I got him. So it was actually, I don't know if you know the backstory of why I got him, but it's actually kind of an interesting story. So I had been doing some volunteer work for CPS, like Child Protective Services. So not anything to do with dogs, obviously, it has to do with children. So with this whole program, you basically get matched up with like a family whose the kids are taken away for whatever reason. There's
Right.
effort of reunification. So I'm like basically working with and counseling this girl who was actually another weird thing. She was like almost my exact same age, right? But she had a drug problem, and she was losing custody of her kids. She also worked at a like dog washing place. And so I go over there one day to like check up on the kids who were like really little, like infant little, and to like check in with her. And I hear barking, and I'm like, this girl got a dog? Like, what? She's definitely like, she was out on parole too. She was like right out of jail. Like, she had all sorts of issues, did not need to be getting a dog, had just gotten her back 2 days ago. So I go in, and of course she's like, yeah, there was this dog. And so at this point in my life, this is like 4 years ago, I had a dog when I was younger, but I was not a huge dog person. I was kind of like, yeah, sure, they're great. Like, nice ones are good. But so I go into her house, and she's like, Ace, and like Ace is there, and he like was a dog. She says that he was like abandoned at the doll washing place. I don't actually know the full story, but like ultimately I was like, you can't have this dog. And then I'm like seeing Ace, and I just all of a sudden, it was like kind of like soulmate dogness. I was like, but this dog is amazing. Like, what is this dog? And I don't even like dog, like I don't care about dogs at the time. And so she ended up like saying like, oh, can you like take care of the dog? Like basically just like, will you figure out what to do with this dog? Because like I am not allowed to have it. My mom and my parole officer and the judge said no. And I got about halfway home and I said, okay, maybe let me like think about it. I got about halfway home and turned around and I was like, if I can't take care of this dog, I'll have one of my friends will take it. Cause I had friends, you know, that would take it. And so then, yeah. And I ended up like just picking up this dog. She didn't have a collar or leash for him. So I've never had like this big black lab. And I'm like, is he gonna like eat my wall? So anyways, that was 4 years ago and I brought Ace home and he's like the best dog in the history of the world. That's the thing. We call him like a human because he does not eat walls at all. He's never eaten anything except for what he's allowed to eat. He's never had to be potty trained. So yeah, we don't know his origin, but yeah, so now I've had him for about 4 years and you know, you never look back with that sort of thing.
Right.
And then not that Lola is amazing too. So Lola is our dog that we've had for about 1.5 years now. And so Lola is a yellow lab.
Fun.
Like white. She's like regal looking. You'll have some pictures here up, but like, yeah, she's a like gorgeous dog who so she has a little bit of an interesting story, not as scandalous, but she was a bred dog. Like, so my fiance is one of his friends he played basketball with in college, breeds dogs up in Dallas, and he breeds these white labs. And so she had ectropion eyelids, which is when your eyelids
turn, yeah.
Anyone who's an OD will know what that means. It's when the eyelids like kind of come out and they get a lot of tears. So she was like a dud for these, like, you know, all these hoity-toity dog breeders. She like was not going to fit in. So we took her. So we ended up, so I was like, oh, she has an eye problem? Like, yes, we will take care of her.
You'll take her.
So yeah, and they are like the best of friends and hang out all the time, obviously. So
yeah, and we have our 2 boxers. So
yes, I love boxers. What are yours names?
Athena and Milo. And Milo, we got Milo 2 years ago, and he's one of the boxers where his tongue always hangs out of his mouth, and he's got the big pushy face, and he's just a baby.
Oh.
And Athena's 12, almost 12. So she's been around a long time. She's very regal. She's that older regal dog. So yeah, that's fun. Loves of my life. Yeah. Along with my kids and my husband, of course, but they count too.
Yeah. So now actually Ace and Lola are at daycare now. So they go to daycare most days because they're 2 labs. And so we're actually still in an apartment because we've been looking for a house for over 1 year, but hopefully that's changing soon. But it's just like, I can't with the 2 labs. We got a field right across the street. So they like, when I'm home, they run all the time, but I just can't keep them up in the apartment all day. So they go to this daycare where they can like have free range. I swear, I know I pay about as much for their daycare as some of my friends on the hall pay for their child's care.
Childcare, yeah. I hear you. And it's worth it. It's absolutely worth it.
Yeah.
All right, Maria, thank you so much for being with us today. Absolutely enjoyed having you on. Love the stories. Thank you for all of your insight. You are absolutely wonderful.
My pleasure. Thanks for having me.
Thanks again. And thanks everyone for joining us for Dede Talks, the Art of Specialty Lenses. A special thanks goes out to ABB Optical for their support in this endeavor. Thank you and have a great day.